Chapter 2 Section 2 Supplementary techniques before and after needling.
Measuring is the technique we use before needling or located the point. We have different ways for measuring. We measure with the fingers, so that basically we located the points and help to needle insert the needles. We measuring for the points with one finger there and another fingers other hand put the needle go in. So that's we talking about measuring with the fingers. The second measuring we talking about measuring through the pressure. So that's basically we just use top of the fingers for measuring. That's for the points. Usually used in the abdominal area because we have a big tissue there. We try to measure in or even pressure for the points. And we also can measure in through the detaching and the moving. So some points we have tendons there and blood vessel there. For example, if we go to the points like pericardium 6, there are tendons on both sides. So we measure in and try to separate the tendons, then put the needle in. So pretty similar like the first one, but this one especially moving the tendons and the blood vessels away. Another measuring is for all located points. We say measuring through the rotating. So that's especially we located, for example, small intestine 6. We say we better put the hand over the chest area, then we can find the point location. So that's moving the body part, the patient's body part. And another way we measure is through the shocking. So that's usually like we shocking patients like the hand or maybe feet, make it more like relaxed and easily located for the points. So like make it relax first, then we try to measure in there. So that's some basic way we measure. Nail scratching is the way we try to mark for the points. We find the points first, then when we find the points, we use our nail make a mark in there. So now you can see clearly it's a mark exactly in the point location. So that's generally say we mark the points like we located the points first. Then we need use alcohol to clear it with mark there, and we are not losing the points. Kneeling. Kneeling is use the nail around the points, some pressure there. We can follow the channels and some pressure in there, try to relieve some pain in there. Then we insert the needles. Holding by fingers. Just prepare to needling by holding the needle close to the points. So that's the way we prepare for the needling. Or maybe go to this way, holding for the needling. Fingering. We can use before needling, and we also can use after needling. So basically we use our fingers, follow the meridian passing the root, and do some pressure or massage there, and help the qi coming. We have two ways to do it. One way is pressure fingering. Pressure fingering means you use your fingers, make a small pressure, follow the channels, and follow the meridians, and small circulation kind of moving. That's pressure fingering. Another way we call finger fingering. Finger fingering, you just use your fingers and follow the root of the meridians and do some small pressure in there and slowly moving there. So that's finger fingering. Both this way help the qi coming. Holding is another method to help the qi moving and flowing, follow the channels. So you can use middle finger, or maybe index finger, or maybe other fingers, just holding there, like help the qi. You can use it this way after needling, and you can use this way like before the needling. If you use this way to after needling, you insert the needle first, and then you can just holding there beside the needle. Pinching is another way to help the qi moving. You can do before the needling or maybe after needling. Like if you after insert needles, and then you use another hand, the fingers, the pinching the skin, and then moving gradually go to thick or illness side. Certainly you can repeatedly to do it, thus sending qi more go to local area. So that's pinching. Knocking is another way to promote qi flowing. So you still can do before the needling or maybe after needling. Like insert the needle first, then you just knocking, follow the channels, and sending qi to the local area. You still can repeatedly to do it. So that's the knocking. Just like slightly tapping to the skin and follow the channels. Patching is another way sending qi to the local area. Like after we insert the needles, and then we use another hand, do some deep patching, follow the channels. That's a little bit deeper patching here. And usually, like patient feels a little bit tender or a little bit sore in the local area. So certainly we still can repeatedly to do it, and we can combination with some other technique, sending qi to the local area. So that's the passion. Tapping, pretty similar like we talking about knocking before, but just more slightly. So that's still follow the channels and repeatedly to do it. Knocking is a little bit deeper, but tapping is more shallow, slightly sending qi to the local area. So that's tapping. Kneading, we use the body of the index finger or maybe in middle fingers. So put to the pulse area, that's kneading there. So basically we can use before the needling, like make the qi like dispersed a little bit, then we needling, reducing some pain. We also can use after needling, especially some points easy cause bleeding. We can kneading there. So that's the kneading. Digging is another way to help the getting qi. So we go to the pulse area, pretty deep pressure there. That's digging. That's clinical way used to helping getting qi or promote qi flowing along the channels. So we can dig in, follow the channels, and remove stagnation in the channels.